Thank you very much, Dr. Hidayat Ansari, for this elegant, stimulating presentation. We are lagging behind time, so we'll just open the floor for 2 questions, and then we will conclude the session.
For me? Welcome, sir.
No. Where is the speaker? Thank you all. I have a quick question for Dr. Ahmed while he is walking to the podium. Now, if you have 2 nodules, what's the space time to do both RFIs for both nodules? Do you wait for 2 weeks, 1 month, or 2 months? And the second question is, why do patients have extreme pain for weeks after the RFI and they keep complaining of it, and that prevents them from going for the second session? Do you have any explanation for the pain? And thank you.
For the first question, if you're talking about the same nodule?
No, 2 nodules.
2 nodules, one on the right, one on the left. I usually space them about 8 to 12 weeks, even the same nodule. But, you know, by criteria, sometimes you have a difficulty because of the insurance and all this, so you have to bring it like 6 months or something like that. But the range,
medical point of view, not insurance.
medical point of view,
You can do
8
them like in
to
8
12,
weeks.
between 2 months to 3 months.
Okay.
You can do the other one. Considering the pain, it's very important that you tell your patient about the level of pain. Now, the pain, first of all, after you finish the procedure, the first few days, they will have pain because it will swell up because of the reaction itself. But very important that they have to use the ice packing. A lot of people skip that. And if they don't use it, it will not subside. Ice will reduce the pain and also the edema itself.
For how long?
A couple of days, but they use it 10 minutes every 1 hour. But they don't have to do it hourly, but at least, yeah. Sometimes you have to place them on an anti-inflammatory, not all, but I usually put them on Panadol. The first 24 hours, 2 tablets every 4 hours.
Okay, thank you.
You're welcome.
The question is for Dr. Salman. Can you tell me what the advantages of transoral versus traditional, and I'm not talking about cosmetic, can you comment on that in your answer on the duration of the procedure, complications, and patient satisfaction? And then I have a second question, so I'll let you first answer.
All right. So for the first question, basically the only advantage you get is no scar. Scar is perceived differently among other people. Some person, they just don't want to see the scar, which is, you know, affecting them. Especially, this is a scar you see every morning. You brush your teeth, you see the scar. If you've done the surgery for, let's say, cancer, and this is just going to be a reminder that you had a cancer, and you start your day every morning.
I know that. I want the other ones.
Yeah. So with regard to the complication, nowadays we actually, when you have the right patient selection, the complication is pretty much exactly the same. The only difference is that potentially you get a mental nerve damage, and now we modified the technique. Even the mental nerve damage is temporary, few weeks, maximum 6 months, and it will back to normal.
Duration of
surgeries. If you go to Ankun, the guy who actually pioneered this technique, he's actually faster doing it transorally.
Second question is, which patient should not go for transoral?
So the contraindication, somebody who had a previous neck surgery, anticoagulation, when they have the thyroid lobe is more than 10 centimeter, or the nodule is more than 6 centimeter. This is like a relative contraindication. Some of the surgeons nowadays, especially with the use of robots and an additional trocar through the axilla, they actually can do neck dissection, central and lateral neck dissection through this transoral technique.
Thank you for all presenters. Because of the limitation of time, we conclude the second session. Sorry, doctor.
Just a small comment. Transoral surgery, we started actually after Thailand in Dubai hospital. We are the first people start doing we did the first thyroglossia cyst worldwide. And we wrote the literature where we introduced Dubai triangles and Amin triangles. We did a great job for that for 7 years. We have got very famous course of transoral, and we do minimal access for last 11 years. Well, now this is a surgery which will guide the world for minimal access and not less scar, less pain if you do it right, you know. And it gives good visualizations for a neck dissection. You know, this is a matter of training. We built Dubai triangle. It's called dissection under vision by assisted indicators, which is abbreviation of Dubai. This will tell you about very important structure to avoid. So it means triangle tells you about where the recurrent nerve is running. These things, it makes the surgery very easy. You know, even it's more easier and less consumable times. Now we do transoral with for neck dissection, it doesn't take more than 2.5 hours, which when we go to do it open, it takes more than 5 hours. You know, thank you very much.
Thank you for all the speakers for the presentation.